tuberculosis is gradually becoming an urban problem. The disease is becoming more urbanized in the sense that there's a lot of movement from the rural to the urban settings. People moving from some of the neighboring countries coming to settle, both legally and illegally.
Wao naenda city council, mahali ya city council. Anasema hawezi patia.
Walinipima nini? Wakanipiga picha kwa tumbo, ikaonekana TB kwa tumbo.
First tangu amepatwa na TB na after 3 months wamenipata TB.
Eastleigh happens to be a place where we get an environment where TB transmission is very common because of the way the people live.
Badan haday guri ku jiraan waa laazim cudurku ay kala qaadayaan hal qof haduu guri ku jiro asay ku koobnaanaysa laakiin haday dad badan ay iskula jiraan way kala qaadayaan cudurkii marka dib baa u geeyay dadka ma haystaan guriyo ma haystaan lacag ay guriyaha ku kireystaan guriyo waa lacag badan marka wixii maanta qof soo hela la wada cunaa marka cudurkii saas uu ku faafaya dhibaatadana keenaysa inuu cudurkii faafo oo dadkii haysanin lacag ay isbitaalada caadiga private ku aadaan ma haystaan marka dhibkii saas ku imanaya. Mimi kwanza hajui watoto na wagonjwa, watoto yangu iko TB lakini hajui kama TB. Mimi napeleka mimi mwenyewe napeleka yeye na kohoa. Alafu mimi napeleka nasema huyu na kohoa. Alafu natuma picha. Amepima, nachukua damu, nachukua picha. Alafu watoto moja anasema iko TB. Alafu baadaye 3 months after 3 months tena kijana mdogo anasema iko TB.
6 months na kujanga hapa. Saizi dawa kidogo amebaki nataka namaliza.
Migrants will not come for treatment in the facilities because of one thing, fear of that they don't have proper papers and documentation to be legally in the country.
Eastleigh iko kidogo shida kama polisi unashika watu mara mingi anaiba hata karatasi ya UN juice ana sijui mtu anayonga anachukua.
In my opinion is that if somebody has a disease they should not be arrested but they should actually be taken care of until they complete their medication. TB is a disease that infects everybody and anybody. In fact, we should desist from stigmatizing TB by labeling a particular group of people that they are the source of TB because they are not the source of TB.
We are also the cause as the health workers because of the attitude we've created against our migrants. Inequality of the services which are given in the facilities. Now there is increase of TB because one thing, there is lack of health education.
In terms of numbers, I think we have enough number of health facilities. But in the sense of looking at accessibility and acceptability of these facilities, that is a different matter. And this could also complicate the disease transmission and also disease suffering in the sense that somebody could have the disease but still not be able to access what is within reach. So if we have those type of people and they have a particular passport, that passport is to identify them for the purpose of treatment and not for anything else. What is important is to manage the condition, and that is the disease, period.
Eastleigh watu wengi ni wagonjwa. Hiyo TB hata ukienda hospitali zingine ukisema umetoka Eastleigh lazima upimiwe kikohozi.
People come take medications for a short while, they hide and they disappear. They develop complications, they develop resistance, they come out because the disease is not yet wiped and they are unwell, it becomes worse, they come again, they take the medicines for a short while, they disappear. It creates a bigger problem.
Sasa ningeambia kama watu ukisikia tu ukikohoa, enda tu upimiwe. Uangaliwe kama si TB, unakuja sasa unapewa dawa zile za kawaida tu.
If everybody would have equal health care services, migrant or non-migrant, tuberculosis infection would go down. Migrants like coming here at Isili Wellness Community Center because I am friendly to them, and we also have an interpreter. So in case there is a language barrier, we also have somebody who intervenes and we communicate directly to the patient.
ay seminaaro u qabtaan si cuduradaasi ay u yaraadaan si dadka refugeega haday jiradaan laaziman Kenyana waa jiradii way la qaybsanaysaa marka jiradii si ay u yaraato oo loo xakameeyo jiradii ay daawona u helaan inay seminaaradaas loo qabto si ay u fahmaan inay isdaaweeyaan.
In partnership with the government, we need to scale up migrant-friendly services. This will reduce inequality, which is currently driving increase in tuberculosis infection within the community of the migrants.
TB does not know boundaries, and that we should be emphatic on making sure that we manage the disease adequately. Any barriers that come into play, including making people to be stigmatized or run away from medication, should not only be addressed, but we should be very critical on how we address those barriers so that the people who have the disease can come out